This is Emily, and I'm going to be assessing her thorax and her lungs today. Emily, do you have any trouble with this upper part of your body or lungs at all? Okay. Is it okay if I assess you today?
Mm-hmm.
Okay. Do you have, I'm going to pull this down. Sorry, should have mentioned that to you. Move your hair out of the way. If I push here, do you have any pain, any tenderness? Okay, I don't feel any lumps. I'm just going to watch you breathe. Just breathe normally. Okay. Everything looks symmetrical. I don't see any deformities at all. I'm going to look around here at your back. Move your hair out of the way again. And again, everything looks symmetrical. I'm watching you breathe. I'm going to put my hands here. I know my hands are a little cold. This is called symmetry of respiratory expansion. Just breathe normal. And that looks normal. Stay right there. I'm going to look at the side of you. I'm looking for your anterior, posterior diameter. You do not have barrel chest like some people have if they have COPD. Okay, that looks normal. All right. I'm going to do some percussing on your back. You're going to feel me tapping back here. I'm just listening to the tissue underneath of it, okay? It sounds low pitched, it sounds hollow, and that signals that you have good resonance, you have good healthy tissue in there. Now I'm going to listen to you, you're fine. Now I'm going to listen to you breathe. Listen to your lungs. Okay, I'll listen to the front of you. Okay, just breathe normal. Sorry, pushing on you. One more. Okay, I just hear a little bit of wheezing, and you said you've been sick, so it's understandable. Do you smoke? Are you around secondhand smoke? Okay, it's real important that you're not. That's a big problem with heart disease and cancer. If you're around secondhand smoke or you're smoking, so try to make sure that you avoid that. Okay. Any questions for me? Okay. Next thing we're going to do is we're going to move on to cardiovascular system. So I'm going to have you sit down here on the bed. First of all, I'm going to have you lay back. I'm going to pull the gown back, and I'm not going to pull too far, but I'm just going to look here at your chest, and I'm looking for any pulsations, or we call it heaves, to make sure that your heart is not moving like it shouldn't be moving, okay? I'm just going to look. And that would be an abnormal sign. And I don't see it, I don't feel it. Okay, looks good. Okay, stay there. Next I'm going to listen to you. I'm going to listen to 4 valves of your heart. First one I'm going to listen to is your aortic valve. Hear that pumping along? Now listen to your pulmonic valve. hear that one pumping along. I hear your tricuspid. See if I can hear it through your gown. Yep. And then your mitral valve. A little harder to hear, but I can hear it. Next thing I'm going to do with my stethoscope, you notice I use this part's called the diaphragm. I'm going to switch and use this side as the bell, and you can hear sounds that would be like a murmur or something that wouldn't be a normal sound. Okay, I'm going to use the other side. Again, I'm going to listen to your aortic valve. Sounds good. I don't hear anything that sounds irregular. Everything sounds regular rhythm. I'm going to step over here and get my timer for my next thing. Can you scoot over here, just scoot this way a little bit? Okay, I want you to pull this up a little bit. Show you, Nellie. Okay. Next thing I'm going to do is I'm going to listen to your apical pulse rate, and I'm going to do this for a full minute and count it, okay? I'm going to go up this way. I'm not going to show anything. I'm going to find it though. I hear your stomach growling. Okay, let me put my timer on. All right, I got 79 beats for your apical pulse rate, and that is where your heart beats, right at the base of your heart, right where it comes down at the tip at the bottom. And that was 78 beats, and it was regular. Okay. Let's see. Heart disease. What can I tell you about heart disease? Do you know if you have any family history of heart disease in your family? You don't know if you have any? Okay. And we talked a little bit about whether you have regular checkups, and you should, because some of the problems with heart disease, like high cholesterol, diabetes, things like that, obesity, which is not your problem, but things like that, if you have a regular checkup, the physician can keep a watch on that, and if you need to be on medication or need to check on it, if you go yearly for your checkup, the doctor can keep a watch on it. Also, females tend to have different symptoms for heart attacks, and females need to know that. You hear a lot about heart attacks where males say they have the crushing pain in their chest and pain down their arm. Females sometimes have atypical symptoms like nausea and vomiting. They have shortness of breath. They have extreme fatigue. They may not have the crushing pain in their chest. They may not have the pain down their arm. They have these other symptoms. So just be aware. I know you're young, but just be aware that there are other symptoms for females for heart attacks that are not the norm, okay? Tenderness in the back, in the jaw. Those are also some signs that females can have that are symptoms of heart attacks that males maybe not complain about, okay? You can sit up now if you'd like for just a second before I make you lay back down. All right, let me feel your radial pulse here. Look right here. Okay, they're equal on both sides, about 2+ in regular. I'll feel down here on your foot, sorry. This is your posterior tibial pulse. Those also are equal, about 2+ in regular. And your dorsalis pedis pulse. Those are both equal, 2+ in regular. Something to remember about your feet, since we checked your pulse in your feet, remember good foot care and wearing shoes that fit well, fit comfortably, okay? Don't squeeze your feet into shoes that don't fit right, okay? Want to take care of those feet. Okay, last thing we're going to check is your abdomen. Do you have any trouble with your stomach? Any nausea, vomiting, anything like that? Okay. I'm going to have you lay back again. I want you to pull that gown up. Okay. All right. First thing I'm going to do, I'm going to listen to your tummy, okay? It's hungry, I know that. All right. I see you have eczema again. Have that everywhere, don't you? I'd say your bowel sounds are all normal. Maybe a little on the hyperactive side because you're hungry. You hear a lot of noise in there. It looks like your stomach is, your abdomen is flat. I don't see anything that would signal that you have any masses. In the skin, all I see is, again, the eczema. There's no scars or anything. I'm going to also, remember how I did the percussion on your back? I'm going to do this again on your stomach. I'm going to be listening for some certain sounds. Is that okay? Okay. Sounds empty. You hear those empty spots? Okay, and that's what we want to hear, that empty sound. If you hear a real dull sound, that might mean, it doesn't always mean something like a mass, but it could mean a mass, but it all sounds normal to me. You said you don't have any pain, anything in your stomach? I'm going to do just some palpation. It's real light. I'm not going to try to hurt you. But as I push on you, tell me if you have any pain, okay? I'm going to push like this. Any pain here? Okay. Any pain here? Okay. Pain here? And pain here. Okay. All right, and the last thing I'm going to do is I'm going to check and see if I can feel your liver. That sounds kind of strange, doesn't it? Put my hand here under your back. I think my hands have probably warmed up a little bit. So feel for your rib. Okay. And as I do this, I want you to take in a deep breath. Okay. And then let it out. I want you to do another one. I know you can take a deeper breath than that. Okay, again, let out. Again. Okay. I can't feel it, and you can't always feel that. But that's what I was trying to do when I was trying to feel your liver. Okay, you can sit up. You did a great job. As far as any education with your abdomen, make sure that you're following a healthy diet. Limit fats, fried foods, junk foods, and we won't get into that because I know what you eat, but fruits and vegetables, and eat a good diet. Make sure you're having regular bowel movements and things like that, okay? And if not, if you're having a lot of nausea, vomiting, or problems like that, please see your doctor and get a checkup and see what's going on. You have any questions for me? Okay, thank you.